So he was having obstructive sleep apnea, and sleep apnea is a problem wherein you're not able to breathe when you're sleeping, because when you lie down, due to few reasons, few physiological reasons or bodily reasons, you have an obstruction behind the throat, and as a result of the obstruction, the air passage is completely blocked and the airflow doesn't happen.
Can I add something before you talk about
sure.
sleep? I just want to add, this is definition that Sadhguru gives about sleep. It is not sleep that you need; it's restfulness that you need. So what happens is, a lot of people, including me, after we do our inner engineering program or whatever, we think, oh, now we are doing meditation. We can manage with less sleep. And maybe sometimes it works depending on our diet and all, but most probably we forcefully get ourselves up, we do yoga, but in the long run it harms.
Famous English club, I think it was Manu. So they had the sleep coach, and this was the first time in the history of sports they had got somebody like this. So he categorized the players according to owls and larks. Okay. Lark is a bird that's very active early in the morning. Okay. Owl
we all know.
at night.
Yeah.
Okay. Based on that, he classified them. I mean, he was able to understand them, understand his clients, and he worked on them based on this. Sadhguru might tell you that you don't need, what was it that he said?
You don't need 8 hours of sleep. If you sleep 8 hours, 1/3 of your life is going. So it's not sleep, it's restfulness you need.
So I think he has a point there. So, but I think some of the quotes are being taken out of context also.
True.
Such a person, if you ask him, how's your sleep? Okay, have you had a good night's sleep? They would say, yeah, I sleep really well. I had a fantastic sleep, no problem at all. Okay, but you know for a fact that he has not slept well. You would have seen him gasping for breath.
Namaskaram everyone, and welcome back to another English episode. Today we have Dr. Shankar, who is a dental practitioner specialized in neuromuscular dentistry, sleep and airway.
Yes.
So welcome to the podcast, Dr. Shankar.
Thank you, Vaishak. Thank you for having me once again.
Yes.
It's an honor to be here. I'm really excited and I'm really looking forward to this podcast in English. So, shall we?
Yes, we shall. So before we go into the English podcast, I just want to set a context to the audience as to why we are doing this. So basically, we had done this episode in Malayalam, and my intent with the Malayalam was it should reach the needed people, and as you know, it reached a few of our meditators. One of our meditators, her father was abroad, who was also suffering from TMJ issues, and I think you were able to help her to find some person in abroad.
So, no, first of all, I would really want to, thank you, because I, as a person, I was somebody who was very averse to doing podcasts and other social media stuff. In fact, I don't even have an Instagram handle. I do have one. I did have one because that was, insisted by one of my patients, and she was pushing me to do it. I'm very grateful for her. But then after that, I lost interest and I just left it. I still don't have a personal account. So you are the one who pulled me to this place. You, insisted that, I should come and do a podcast because the science behind neuromuscular dentistry or what I'm practicing is of great importance and it should reach out. So that was your intention and I should really thank you. So a big shout out to you and for the podcast and for the entire team. And as a result of that podcast, after watching that podcast, quite a few people reached out. They even took the treatment also. Not just the meditators, there was a few others also.
Okay.
So there was this very sweet lady from Chalakudi. I mean, such a wonderful person, amazing person. She called me and she told me that I saw your podcast. That is why immediately after seeing, I'm calling you. And she said that I'm in a lot of pain. Everything that you had mentioned on the podcast, I'm living it. I want to come out of it. And as she was explaining her symptoms, she just broke out. I mean, broke down and she started crying. And she said that, I really want a solution for this. And she took the treatment and I did the first review a few days back. She's doing really well. I would say she's 80% she's recovered. So the first thing what I said was, it was through Vaishak's podcast, this information got to you. And so even myself and also the patient, the lady, she is very grateful for you.
Thank you.
So
Thank you.
so keep doing the great work that you're doing, and yeah, thank you.
Yeah. So I distinctly remember one of my close friends, her father, she was talking about how her father was, sitting on the sofa,
Yeah.
putting his tongue out and then sleeping.
Yes.
That's when I immediately remembered, the podcast we had, and I insisted, like, you have to call Dr. Shankar.
Right.
And I think they came and consulted you, and I think maybe 2 or 3 sessions they took, and there's a drastic change that from his sofa is now able to at least lie down on his bed and sleep. And I'm
Yes.
sure as he continues his treatment with you, he'll get a lot better.
But in fact, I did a phone call review. I'll be seeing him this coming Monday. So this person, he was having trouble sleeping because he was having obstructive sleep apnea. So we'll talk about that in depth, once we get into the subject. So he was having obstructive sleep apnea, and sleep apnea is a problem wherein you're not able to breathe when you're sleeping, because when you lie down, due to few reasons, few physiological reasons or bodily reasons, you have an obstruction behind the throat. And as a result of the obstruction, the air passage is completely blocked and the airflow doesn't happen. So you are literally fighting to stay alive, okay? And you're gasping for breath all the time, continuously. So as this happens, as a way to compensate this blockage, certain people, what they do is they stick their tongue out like this, so that the tongue doesn't fall back and the air passage remains patent. So that's exactly what he was doing. He was trying to save himself from getting choked, basically, and he was really struggling to sleep. So what he told me was that, see, I've done so many things. He's even done so many dental devices also.
What all has he done? Could you tell me?
So he has gone to multiple neurologists, I think, even to a pulmonologist. He was using a CPAP machine. So CPAP machine is a machine that pumps in air from the outside, and you have it's a machine and it's connected to a mask, and you'd have to wear the mask. So the mask sort of looks a little daunting. Have you seen the movie Batman?
Yes.
Batman.
Last one, Dark Knight
Yeah,
Rises.
the Dark Knight. So you have this character, no, Bane. Yeah, the name is Bane, right?
Yeah, Bane only.
So you see him wearing a mask.
Right.
It's very similar to that. Okay, and you can the people inside the room can actually hear you breathe. Okay? Every time you inhale and exhale, you can actually hear what's going on. So he was supposed to wear the mask, and he tried wearing it. So the air, the machine sort of pushes the air from the outside, and it pushes into your nose and the throat, so that the airway remains patent. He tried that. That actually helps a lot of people, but not the compliance is a big factor. It doesn't help few people also. So you don't have a one pill solution for all. Every treatment needs to be tailored according to the patient's needs and the challenges. So he had tried CPAP, he had tried medications, he had even tried sleep dental devices, which is very similar to what I do, but there's a lot of difference in the way I do it. But the concept is almost the same. He had even tried that. He had even tried a product from the UK. He was so desperate. I mean, I feel very bad for him, because he back then, this was 15 years or 15 years ago, when Amazon and the other online shopping options were not there. Somehow he purchased this dental sleep device from the UK, from an online this one store, and he tried it. Okay, so he was really trying, but unfortunately nothing worked. And after all that, he was sleep was a big issue for him. It was always a nightmare when it came to bedtime, because it's such a daunting task. Just imagine, you have to go to sleep, but you're not able to breathe, and you know that you're going to be totally uncomfortable when you're sleeping. So that is sleep apnea for you. And there are different versions of sleep apnea. You have an obstructive sleep apnea. You have a central sleep apnea. You have a mixed sleep apnea also. Sorry, I'm being a little technical here. Few jargons, but it's important that we understand this. So apnea is a situation wherein there is a complete cessation of breath, wherein you're not able to breathe. Okay. then sometimes what happens is, along with the apnea, you don't have a complete obstruction. You would have a partial obstruction. That's called a hypapnea. So some people would have a combination of apnea and hypapnea, and you add both these factors together and you divide by the total hours of sleep that you've had. That gives you an index. Okay, so let's say you have an AHI index, apnea hypapnea index of 30.
Okay.
So what that means is, in 1 hour you have had 30 events or 30 episodes of airway blockage.
What about a normal person with a good sleep? What would his index be?
See, anywhere between 5 to 15 is considered to be normal.
Okay.
0 to 5 is normal. 5 to 15 is mild. But you can say mild also to be okay. But when I look at the sleep report, I don't always go by the AHI index. It's important that we look at other biomarkers and other parameters also. But I think for the listeners, this is I think this is all the basic information that they really need to look at. I don't want to get too technical, because the sleep itself is a very sleepy subject. Because it's such a dry topic. Unless and until you're very nerdy, you're really into it, it's not going to excite you. It's definitely going to put you to sleep. So based on the AHI index, the treatment options also vary. Treatments also vary depending on the AHI. See, because if you have a mild AHI, mild sleep apnea, you wouldn't have to go for a CPAP machine. You could try something on a very conservative scale. If it is mild and moderate, then even if it's for a moderate, also the treatment option would vary. If it's a very severe one, then sometimes we would have to consider surgical options also. So these are the things. So it's like the best thing about sleep apnea, and also the most challenging thing about sleep apnea is that you would have so many professionals coming into it, so many medical professionals and different branches of medicine addressing this subject at the same time. They would have their expertise. You would really have to get their help also. So a pulmonologist help is definitely needed. An ENT's help is definitely needed. A dentist plays a very important role. So all three of them, and even sometimes you would have myofunctional therapists. You would have other people also, coming in, like diet, exercise, lifestyle, this alterations. All these things would have to be incorporated. So it's not a one pill solution. So it's a multidisciplinary approach. That's also the reason why it's so complicated.
So sleep is such a simple thing, but yet if you have a dysfunction, it becomes very complicated.
Oh yes, 100%. And as a dentist, people would think, why a dentist is looking at the sleep. Yeah, what does he have to do with it? Yeah. So basically, if a dentist is asking you a sleep questionnaire, if he is interested in your sleep, basically what he's trying to see is...
He's a good dentist.
Of course, 100%. Not everybody does that.
Okay.
Because I'll come to that.
Okay.
As a dentist, I'm looking at how functional your airway is. I'm more interested in how your airway is functioning. Okay. And the best parameter for that is when you sleep. Okay. When you're totally unconscious. Okay. The only thing, the only physiological process that's happening or that is keeping you alive is the breath work. Okay. Is the respiratory system. And I can really assess. I can see if it is functioning or not. Okay, if it's happening in a proper way. If it's dysfunction, then there are so many problems associated with it, and I can address the root cause of all these problems by addressing the sleep. Simple as that. So airway is the most important thing. And as a dentist, I can play around with the airway. I can make a person or break a person. Nobody does it intentionally, but if your treatment planning is not centered around the airway, then things can go wrong.
if you don't pay your fees properly.
That also. Okay.
So
Yeah.
before we go on that tangent, we missed the main point, like what is neuromuscular dentistry?
Wow.
And we also need to talk about the history behind like how this science came across. Like everyone wants science nowadays,
Okay.
So how, is it scientific or is it just a mumbo jumbo, like a hippie? Like in the last Malayalam podcast, you
Yeah.
told this is not a hippie thing.
Yeah.
So is it a
Yeah.
hippie thing?
So neuromuscular dentistry, it's a branch of dentistry which has been there since 1960s, I would say. I don't remember exactly, but sometime between 1960s and 70s, it was developed by this doctor called Dr. Robert Jankelson, Robert or Bernard, I'm not sure. I think Bernie is his son, or basically by Jankelson Senior. So he was the father of neuromuscular dentistry. And so what actually happened was his wife was suffering from a lot of chronic pain issues, and at that time, with the limited medical facilities or the provisions that they had, they made a diagnosis of multiple sclerosis. Okay, so but for some reason he wasn't very sure if it was multiple sclerosis.
So Shankarana, what is this multiple sclerosis? Could you explain it in a bit?
When Dr. Jankelson's wife was diagnosed with multiple sclerosis, it's a autoimmune condition. It sort of affects the myelination or the covering of the nerve. The conduction of the nerve sort of degrades. Okay, and as a result of that, you can have various neurological issues, right from pain, constant pain, loss of vision, loss of hand, foot coordination, incoordinated movements, inability to stand, you name it. I mean, it's all there. Basically, it affects the entire body's nerve myelination, or the conduction process of the nerve goes in for a toss. So that's what they said it was. But he thought he had some other plans. He thought it could be due to her bite, and he worked on the bite. So I'll tell you about Bernard Jankelson's wife. So she was having pain. Okay, she was having a lot of headaches. Okay, and she was having complete body pain. Okay, and her motor skills, or her hand coordinations, and she was having total numbness of one side of the body. One arm was totally getting numb. She was having ear pain. She was having neck aches, back aches, basically in a lot of pain. Okay, and nobody knew what exactly was going on. So as a dentist, he thought there could be something to do with the jaw. Okay, so if I can get the jaw in the proper position, then things could work out. That was his logic. Okay, so what he did was he worked. He was from Seattle. Seattle is also the place where you have the Boeing manufacturing. The Boeing planes were actually made. So he got in a lot of ex-employees or ex-engineers from Boeing, and he sort of used. I think it was his leadership. Okay, he was a brain behind this. He invented certain machines to record and to measure certain physiological aspects in the body. Okay, he came up with the jaw tracker. Okay, like it sort of gives you a 3-dimensional orientation or 3-dimensional positioning of the jaw. Okay, and based on that, he was able to get the live muscle activity of the muscles on the face and the neck. So I mean, he was a brilliant guy, but unfortunately, not too many people know about him. Okay, not enough credit has been given to this person. Very unfortunate, because of a lot of academic ego. People always think that their identity, or what they believe or what they have studied, to be the most important, or to be superlative to the other. So he came up with this, and he was able to understand the muscles. He was able to understand the physiology of the muscles. He was able to understand how the nerves or the neurological significance of these muscle activities were, and he was able to understand the importance of the position of the jaw, the teeth, the way the teeth came in contact. Am I getting too complicated?
No, it's fine. It's fine. But could you explain it in simple terms? Like, let me get back to this. Like, one of the reasons why I'm doing this is, many of the people watching this video, they're already into yoga.
Yeah. Okay, fine. So basically, to put it in a nutshell, if you can get the jaw in the correct position, that's
okay.
what Dr. Jankelson did.
Okay.
He got his wife's jaw into a better position.
Better position, okay.
In a position where all the muscles and the nerves were in a state of harmony.
Yeah.
Okay. And the body sort of healed itself.
Yeah. So,
Simple as that.
like in the Malayalam podcast, you use the example of your aunt. I think that makes it very simple for the audience to, get what they understand. But before you tell that, I just want to share this thing. See, many of the viewers watching this are, people who are into yoga, meditation, because that's my audience. Even I myself, when I found Sadhguru, I was having some, anxiety and all. So for me, my mental health improved a lot after these practices. But at the same time, I found that adding other things like dance, coloring also helped in getting it much better. So what I notice is a lot of people come to Sadhguru with a lot of physical ailments also, like back pain, neck pain and all this. And by doing the Hatha Yoga practices and all, it helps them. But I've also noticed a few people for whom it doesn't get better, and they push themselves in such a way that they might even get injured by not doing it properly. But just adding the new, like neuromuscular dentistry, or maybe it's physiotherapy, their living conditions can improve a lot.
Yes.
So that is why I feel this podcast is also for those people who think, I should only do yoga, I should not try anything else.
Yeah.
So if you could share that example of your aunt, and how you came across neuromuscular dentistry, and how you thought about this, it would be great. I think we can make it more simpler like that.
Yeah. So let me sort of decode or restructure your question. So basically, what you're saying is, you have tried everything. Okay, everything possible under the sun, all the treatment options. But what is that missing piece of the puzzle? Okay. What could have gone wrong? What could have been something that people have missed out? I'm not saying for everybody, but for a lot of people, it could be the bite. Okay, it could be the airway. It could be how the airway was impacting their sleep. It could be the position of the jaw. Okay, because this is the highest joint in the body. Beyond this, you don't have any other joint.
But is it that important? Just the bite? Why is it so significant?
It's a simple but a very tough question because it's like there are lectures happening on this subject on this very question
because someone
for
might
2
think
days.
we are just trying to make a podcast out of the bite.
Yeah. No. I came prepared talking for sleep, but we are again talking about the TM joint.
Yes.
So this is the joint. The highest joint in the body is called the temporomandibular joint. So any disorder in this joint is called a TMJ disorder. So people colloquially they say I have a TMJ problem. Okay. They say I have a TMJ. Okay. Of course, everybody has a TMJ. Okay, everybody will have a jaw joint. Okay, but a problem happening in the joint is called a TM joint. TMJ disorder. Okay, so this is the highest joint in the body, and why this is so important is because this is the only joint in the body where the end point of the joint or the position of the joint is determined by another factor. Okay, in this joint it's the teeth. Okay, if your teeth are not in the proper position, if the alignment of the teeth is not in the right way, wherein if you have a constricted arch and if you have not enough tongue space, your joint positioning can also get affected. Now, if you have a problem in the joint, what is going to happen is you're going to have a lot of neuro modulatory impact. Okay.
What is that?
Meaning, let's say I have an inflammation in the TM joint. Now, as the inflammation progresses, I'm going to get inflammation in my cervical bones also. Okay, in my C1, C2, C3, and it progresses like that. Yes. Okay, because that's how important this joint is.
So what is it? Does that person get back pain, neck pain? In simple terms, what does...
Yeah, he can be in a lot of discomfort. He can be in a lot of pain, a lot of muscle stiffness, a lot of dysfunction. You can have postural changes. You can have there are even disturbed sleep. Brain fogging can also happen because it's going to impact the blood circulation to the brain also. So the center of rotation of the neck is actually on the bite. Okay, because just imagine you're drawing an imaginary line at the level of the bite, and it goes all the way behind the neck. Okay, it goes at the level of C1 and C2. Okay, cervical bone 1 and 2. So if I change your bite, the first impact it's going to be on the neck. Okay, and vice versa. You can have a change in the jaw position also if you have a stiff neck, or if you have a compensation in your posture, or if you have a rotation in your cervical vertebra. So this is the basic. This is the basic of neuromuscular dentistry. So if the position of the jaw is altered, you're going to have facial asymmetry. You're going to have jaw pain. You're going to have difficulty opening and closing your mouth. You're going to have clicks, pops, unresolved ear pain. You're going to have vertigo, constant vertigos. You're going to have, of course, vertigo can also happen for a lot of other reasons. You're also going to get headaches and migraines. Okay, people might say, no man, doctor said I have sinus headaches. Most of the sinus headaches, people who have said that they've had sinus headaches, their headaches have gone once you correct the bite. Okay, then you have neck pain, you have back pain also. Recently I had a patient who said that she had an irritable bowel disease.
Stomach.
Yes.
Okay.
And that was our intention was not to treat for IBS, and also at the same time she was lactose intolerant.
Oh.
And she had severe back pain. Okay, she came all the way from Kollam. Okay, she was traveling all the way from Kollam, and she was coming to Ernakulam to get the treatment done. Okay, so imagine, and she would say that it was extremely hard for her to travel on the train. Okay, and bus to can't even think about it. So once we got the bite corrected, okay, I'm not going into the treatment part of it in depth. Let's say that I corrected her bite, and for the first review when she came, so what she told me was that, doctor, does it have anything to do with my IBS? I said, well, there are certain explanations for that, but that was not our intention. Our intention was to get you off your headaches, your facial pain, and the neck pain. She was in a lot of discomfort, and interestingly, the whole root cause for her issue came from she was having this conversation with her father, okay, and all of a sudden he just collapsed and he passed away. So that was very traumatizing for her. So this is what she said. She said that I know that I had these clicks. Okay, I was aware that I had these clicks and everything, but I wasn't really concerned by them because I didn't have pain. She didn't have IBS back then. She didn't have any other health-wise issues. She did not have. She was perfectly healthy. And she said that after this particular incident, she fell into a state of depression also. She was a psychiatrist.
She was a psychiatrist?
Yeah, she is still.
Okay.
She's gone abroad for her further pursuing her further studies. Yeah, so she said that it all started from there. Okay, she could never come in terms with that event. It was very traumatizing for her. So I said that okay, these things have happened. The healing has to happen from within. I can connect you to people for that, but I am not the person for it. I can get you off pain. Okay, this is what I said. And I can do that. I know this is what the problem is, and this is what that needs to be done. She said, okay, we'll do it. And the first review when she came, she traveled, I think she came by bus, I think. Yeah. And this is what she said, that, I was able to sit for a long time without back pain, and I could travel. And I was able to have tea, coffee and everything. Even though she was lactose intolerant before, she was able to have tea, coffee, and milk tea, milk coffee and all that. And her IBS was gone. Okay. Then I was, confused. Like, now the challenge for me was to study, how this particular treatment sort of cured the IBS.
Right.
But what I understood was, once we corrected the bite and once we got the joint into the jaw joint in the proper position, her neck sort of aligned in a perfect way. The posture also changed. Her postural imbalances sort of evened out. Her hip alignment also got stabilized all through the bite. Okay. So once that happened, I think the body was able to heal itself. Okay, so all the imbalances in the nervous system due to the posture, the body was constantly trying to keep itself in a state of in a balance, homeostasis. That was not there. That was absent for a very long time for her. So that sort of affected her entire autonomic nervous system, is what I feel. So once the bite was corrected, things just fell in place. The body was able to heal itself. So this is the simplest.
So the mental
So-
trauma caused a lot of changes in the body physically
Yeah.
and all. But when you corrected physically, the mental also healed. Like it's like wise. It works both ways.
Yes, absolutely. So I have this privilege of working with some amazing doctors who have passed out from AFMC, Armed Force Medical College, and they are doing different kind of work in terms of, some of them are doing psychiatrists basically. They are into healing also. So people who get into these kind of field, this particular field, even though you have a very solid medical school background, and even if you get into it, the mainstream academy sort of looks down at you. Okay. So they're not very keen on coming out and saying this is what I do, this is what's happening. They very quietly they do their stuff. So basically I work with these people, and some of the cases that I've seen was just outstanding. Okay, because it is from them that I've actually understood that any event or any incident can have a big impact on your emotional body as well as your spiritual body. That can manifest in your physical body also. So even if you correct the physical trauma that has happened, the real healing should also happen at these two planes. If that doesn't happen, then there is always a good chance of the physical problems also to come back.
Right.
Okay, so everything has to go hand in hand. So now that I have an access to these people, I can always refer people to them, and they can sort these things out.
Right.
So this is when this is where it becomes a comprehensive or a holistic approach, and this is very very needed. This is very essential in today's medical practices. What I feel. This is my personal take. Yeah, so that's that.
So that's very beautiful. But I want to also know, how did you come across? You're a dentist, so you should be going through your work. So how did this interest in neuromuscular dentistry come, and who introduced you into this field?
Yes, so my mentor, it is through my mentor that I came to neuromuscular dentistry, and one of the main reasons for this was through my aunt. So my aunt, she was suffering from chronic migraines. Okay, she had a really good tuition, practice, or I don't know what you want to call a tuition center. This
Time
was way,
tuition.
yeah, this was like 35 years ago, when the whole concept of tuition was very, giving tuition lessons to school kids, special attention on certain subjects, and all these things were very new back then. Okay, so she had like a lot of students, but it came to a point where she was not able to handle her health. Okay, she was in constant pain, headaches, migraines, chronic neck pain, back pain. There was 5 times a week or 4 times a week she would have migraine attacks. Okay, she would be lying down. She can't see lights. She was having problems getting exposed to lights, certain sounds, certain smell of food, and all that. And she would have a very terrible time. So that's going to have a big impact on your career also. So the students, so she didn't want to take up too many students, and then slowly I saw her career sort of spiraling down. And later on, when I got introduced to my mentor, and when I saw his cases, that's when I realized that this could be my aunt also. That's when I took my aunt to my mentor, and we did this. We incorporated this neuromuscular subject, or this treatment protocol. We got her bite corrected, and she was one of the most difficult cases that they've actually handled, because her neck was straight. Okay, there is a normal curvature of the neck. She had completely lost it, and it was straight like a stick. Okay, and that's very bad. That's very bad for you. And because of that, it was extremely challenging. In spite of all that, by just correcting the bite itself, we were able to add a lot of quality to her life in terms of pain. Okay, to have a pain-free life is one of the basic human rights, which is that a person should have. That's a new definition, I think, by the United Nations. There is this,
WHO?
not WHO, yeah, WHO, or there is this United Nations Human Rights something organization. So they came up with this definition. Okay, maybe WHO, I don't know, but I happened to come across this. It is your basic right to be pain free. Every human should have an access to a pain free life. That's what they said. So we were able to give that through the science. So I was able to see this. This is something that happened in my family. This sort of inspired me a lot, and I thought, what? And there are so many people with similar problems in this world, in our society, and I thought, why not, help them at least. If I can get them off their pain by 50%, they could have a brilliant life. So this is what actually pulled me to this neuromuscular dentistry, and I saw the impact of it, and I was seeing this, and after treating patients one by one, I could see it was such a gratifying experience, because they would come and tell you, I've been having migraines and pain for the past so many years. I was on pills for a long time, and now I am pain free. It's as simple as that, and I'm not taking any medicines. I haven't done any surgery. I haven't done any fancy treatments or anything. I just corrected the bite.
Right.
Some people find correcting the bite also to be a little fancy, yeah?
Right. Beautiful,
Yeah.
Shankar, beautiful. It's great work you're doing. I just want to add one more thing. Usually, this migraine issues and all, it's mostly I hear from ladies, my aunts. And so is there something like it's mostly women who get these problems, or is it common among men, women and kids? How does that work?
So in my practice, I would say 70% of my patients are women. Okay. It's there for so many reasons. So let's sort of get back to the subject of sleep also with this.
Yes, definitely.
Okay. Pain and sleep.
Can I add something before you talk
Yeah,
about
sure.
sleep? I just want to add, this is definition that Sadhguru gives about sleep. It is not sleep that you need, it's restfulness that you need. So what happens is, a lot of people, including me, after we do our inner engineering program or whatever, we think, oh, now we are doing meditation, we can manage with less sleep. And maybe sometimes it works depending on our diet and all, but most probably we forcefully get ourselves up, we do yoga, but in the long run it harms us a lot. And I've noticed this with myself and with a lot of other meditators. So can we define what sleep is? What is, like, let's say, what is sleep in simple terms, and how much hours one does need? Is it, should we sleep early, wake up early, or sleep late, wake up late? This is like always the
Okay, I think
debate.
I'll start with the last question.
Yeah.
It depends.
Okay.
It depends from person to person. Okay, you can be a nighttime guy, but you can be an owl, or you can be a lark. Lark is somebody who's a morning person.
How do
so-
we find it? Like,
It depends on individual. Some people are more comfortable, studying late night. They are more active, and their brain functioning is better at night. So you let that happen.
you do not force them to sleep early or anything.
No, see, I'll tell you why, because I'm not going to give you any research quote on this. This, you've heard of this team called Manchester United.
Yes.
So they actually had a sleep coach.
Okay.
Okay. I don't know if it was Manchester United or Arsenal. Anyway, so there was this very famous English club. I think it was Man U. So they had the sleep coach. And this was the first time in the history of sports they had got somebody like this. So he categorized the players according to owls and larks.
Okay.
Okay. Lark is a bird that's very active early in the morning. Okay. Owl is
Owl we all know.
at night.
Yeah.
Okay. Based on that, he classified them. I mean, he was able to understand them, understand his clients, and he worked on them based on this. Okay. Very simple. So you can be a nighttime person, you can be a daytime person also.
Okay.
And you can work on it accordingly. And how many hours of sleep? Science, physiology, the American Academy of Sleep Medicine tells you that you need minimum of 7 to 8 hours of sleep.
Right.
Is that practical for everybody? For some, yes. For some, it is not. But what they have all missed out is the quality of sleep. People are trying to give you the quantity of sleep.
Right. True.
But the quality of sleep is not being addressed. So our content right now, as we discuss, is going to address that. We are going to talk about the quality of sleep. Sadhguru might tell you that you don't need what was it that he said?
You don't need 8 hours of sleep. If you sleep 8 hours, 1/3 of your life is going. So it's not sleep, it's restfulness you need.
So I think he has a point there. So, but I think some of the quotes are being taken out of context
Yes,
also.
true.
So quality of sleep is the most important thing. Even let's say you're sleeping for 8 hours, and if you have a restricted breathing or some form of sleep breathing disorder, the sleep breathing disorder is not being addressed. Okay, you must have heard of Lou Coutinho. I even watched one of his interviews, but he never. I don't think he was giving enough emphasis on the sleep breathing part.
He's on Ranveer Alabadia's podcast. Look at the same person, right? He's very into fitness and
yes. So nobody really gives talks about the importance of quality of sleep. You can enhance the quality of sleep by working on your breathing also. Okay, so this is where the importance of yoga and everything comes. Okay, it can be an excellent adjunct to all the treatments that you're doing. In fact, the first patient that we had discussed, the gentleman who was putting his tongue out and sleeping, he was such a brilliant guy. I mean, he was so active, he was so sharp. In spite of having all these issues, his level of focus and his level of attention, and he was very lively. His sense of humor, he was very spontaneous. Why was that? Is because he was constantly doing his kriyas. Okay, kriya is always a very supporting act. Okay, it's supporting process. No matter what you do, it's going to support you. Even if you don't do anything, also if you do kriya to a certain extent, it will help you. But is that going to help everybody like that? No. So for certain people, the primary thing that would have to be addressed would be the quality of the sleep or the sleep breathing part of it. So what is sleep breathing disorders? It's a huge spectrum of let's say sleep problems. Okay, sleep issue itself is a huge subject. In that you have a very small subject called sleep breathing disorder. In that sleep breathing disorder, for the sake of discussion or for convenience, let us categorize into 3 parts. One, let's say I'm not trying to body shame anybody or anything, but just to understand for our viewers to picturize. Let's say the big fat guy, okay, big fat man. That would be your case of sleep apnea. Okay, sleep apnea happens for women also, but it's more common in men. Okay, now the second would be a young fit female.
Young fit female.
Yes.
Okay.
They would look pretty thin.
Okay.
I'm not saying they're
no, we don't need to be politically correct.
Yeah. So let's say they're not overweight.
Right.
Okay, and they don't have a huge neck circumference. They look pretty lean, thin, and active.
Like Deepika Padukone?
Maybe.
Okay.
Maybe.
Okay.
So they would have a problem called an upper airway resistance syndrome. Basically, when you're breathing, when you're sleeping and when you're breathing, it is not a complete blockage of air that you're going to have. You're going to have a restricted form of breathing. And that restricted form of breathing is going to happen for the next 8 hours.
But you won't wake up or anything.
No. You would. We'll come to that. Okay. That is the second group. That's the second category. The third and the most important are going to be the kids. Okay. Kids are going to be the most important because it's only in kids that you can actually do a proper treatment. For the others, we can sort of manage the condition. Treatment and management are 2 different things. But yes, for certain people, we can do a permanent rehabilitation also. A treatment can also be rendered. But for a huge group of people, it is only a management that's going to be possible. So these are our 3 categories.
Let's start with the first.
Let's
go for the first category.
The first category, the big fat man. Okay, sleep apnea. Like we are discussing initially, what is apnea? Complete cessation of breath. You're not able to breathe when you're sleeping. So you would have seen and you would have heard people snore, right? Okay, so if you look at a person who's snoring is only something that is it's a phenomenon at the tip of the iceberg, but there is something even more. Okay, you have a condition after the person snores. There could be, for a lot of people, they would be stopping to breathe. They wouldn't be able to breathe. All right. Now, that is the obstruction that is happening at the back of their throat. That is obstructive sleep apnea for you. Okay. Such a person, if you ask him, how is your sleep? Okay. Have you had a good night's sleep? They would say, yeah, I sleep really well. I had a fantastic sleep. No problem at all. Okay. But you know for a fact that he has not slept well. You would have seen him gasping for breath. But they don't realize this. All right. So, how is that going to affect that person? Excessive daytime sleepiness, excessive fat gain in the body. That's going to be a major hormonal imbalance that's going to happen. Okay. Your entire metabolism is going to go in for a toss. Okay. And generally, men, they have something called, they get, as a result of sleep apnea, they get erectile dysfunction because of the excess fat deposition that's happening on the abdomen.
Right.
Beneath your abdomen, the blood flow or the blood supply is going to be very less. Okay. And the testosterone level in your body is also going to come down. Okay. Because you're not getting that deep state of sleep.
Okay.
All right. This is happening for men mainly. And this can also happen for people if you have an altered jaw structure. Okay. Now, this is where the dentists, they're going to have a major role. Let's say you're taking out your teeth and doing the braces. You're pushing the tongue back. Okay, there is the chances of you having sleep apnea is going to be much more, and people are going to go in for depression. Okay, it's going to alter your breathing also. When I say alter your breathing, people might think that you need to have good amount of oxygen. Okay, but you need to have good amount of carbon dioxide.
Oh.
All right. So most of the people who have these chronic problems, chronic health issues, even mental health issues, they would be having something called hypocapnia, low carbon dioxide level in the body.
You need more carbon dioxide in the
Yes,
body?
because
That's the first time I'm hearing that.
Yes, it's not the first time. You have something called Buteyko method. Okay. Free divers. I was somebody who was doing free diving, so I don't do it anymore. But free diving, what you do is you sort of get your body into a state where you can tolerate high levels of carbon dioxide. Okay. And you take one breath and you go underneath the ocean. You try to go as deep as you can and then you come back. So basically, hypocapnia is when you have a low level of carbon dioxide. The ideal level of carbon dioxide in the body should be 37 to 42 is the normal level. Okay, mm of mercury. Okay, that's a unit. Now, if you have less than that, what happens is your cellular oxygenation is not going to happen. You know that the blood carries oxygen, right? Hemoglobin contains the oxygen. Now, if it has to deliver it to the cells, you need to have a catalyst that is going to break it down. That is carbon dioxide for you.
Okay.
So, if you don't have that, cellular oxygenation is not going to be there. So, people, let's say that, a person with sleep apnea, his carbon dioxide levels are going to be low. Okay. His cellular carbon dioxide level is going to be low. But people will say that he is having hypercapnia, okay, because he is holding his breath. That is one thing, and your cellular oxygen level is another thing. Okay, I know it can be a little confusing. Let's just say that you're not able to breathe well, and your sleep is getting disturbed. Your hormonal impact is going to be there. Variations are going to be there. You're going to gain a lot of weight. Okay, and you're going to be sleepy all the time. You're going to have excess daytime sleepiness, and it's going to affect your productivity. You're going to have brain fogging. You wouldn't be able to think properly. Memory loss, loss of interest in so many activities, and you go. I mean, you sort of what to say. You would say that this is all what it is. I just want to be like this. So you're not going to function at your optimal. That's not going to happen.
Right.
This is sleep apnea.
Sleep apnea.
It can happen in men, in women, and kids also. Children also it will happen, but mainly in men. That is why I say the big fat man.
Big fat man.
Okay. If you have an increased neck circumference, you're going to have sleep apnea. Simple as that. All right. And insomnia. You wouldn't be able to sleep well also. You know what insomnia is, right?
Yeah. But could you explain like insomnia? What is insomnia?
Inability to sleep.
Inability. Like, let's say my regular time is 9 p.m. When I go at 9 p.m., I'm not able to sleep.
So you have two types of insomnias. Okay. One is onset insomnia. You're not able to start your sleep.
Okay.
Okay, then you
That
have something
happens.
called maintenance insomnia. Okay, where you are able to sleep properly. Okay, you're able to get that start, but in between you wake up and you lose it. You're not able to get back to sleep again. That is maintenance insomnia.
Okay.
In sleep apnea patients, you find these two forms of insomnia is happening. So when somebody tells you, okay, see, when somebody has traveled from the US or from a different time zone, and when they come and they say that I'm not able to sleep, that's a different thing. Okay, but this one is on a daily basis. All right, so insomnia, if you have, the first thing that you need to look for in insomnia is sleep apnea. How do you diagnose these things? How can you find out that if you have sleep apnea or not, or any form of sleep breathing disorder? The simplest test that you can do is to do a sleep study. A home sleep study is something that you can actually do. You can get somebody to come home, fix the machines, and then go to sleep, and that will give you a report which is good enough to tell you if you have some form of a sleep breathing disorder. And based on that, the treatment can be rendered. It's as simple as that. Now the second category of our sleep patients are going to be the young fit female. Okay, now females in like I said, sleep apnea can happen in women also, but mainly what I see is an upper airway resistance when they breathe. Okay, if you have a restricted form of breathing, even in upper airway resistance syndrome also, women are not aware that they have this form of a restricted breathing.
How does that look like?
So it's a very technical thing. I mean, you would have to measure the inspiratory flow. Okay, when you have an inspiratory flow limitation, so just imagine you're trying to breathe in through one nostril. Okay. It's a restricted form of breathing. Okay, it's going to be something very similar to that. And if you continue doing that for your entire sleep cycle, your body is going to be in a state of stress all the time. So you are in a constant state of fight or flight. All right. So when you're in a constant state of fight or flight, there's going to be a lot of adrenaline and epinephrine release in the body. So when this happens over a long period of time, your adrenalines are going to get fatigued. Okay, so your ability to cope up with stress also becomes very less. Okay, and you would have seen certain ladies in their late early 50s or in their late 40s. They would they would go through a midlife crisis. Okay, one of the main reasons is because their inability to handle stress. Okay, even I'm not trying to generalize here, but even a small amount of stress, small amount of variations from the normalcy, they would get really worked up. Okay, they wouldn't be able to handle the situation. Now the main reason is because their adrenalines are fatigued. They are not able to cope up with the stress. Why is this happening? In that particular age group, there is a hormonal variation that generally happens. Okay, when they're going to hit the menopause stage, your progesterone levels actually come down. Okay, progesterone as a hormone, it's very important because it's a bronchodilator. Okay, it's a pharyngodilator also. So basically it sort of opens up the airway. Okay, so once that drops, you're going to have an altered breathing. Okay, a dysfunctional form of breathing. So for such a person, every time they sleep, the restful state of sleep you're not able to get. Okay, even at the slightest of the sounds, they would wake up. So all these things, what I'm saying right now, it's for people to associate with. Okay, it's not necessary that everybody should have all the features that I've said. All right. So when you're not able to get that restful deep state of sleep, you're constantly in a state of fight or flight. You're going to be worked up all the time. Okay, and you will wake up with headaches. You will wake up with a lot of stiff neck and stiff shoulders. Sometimes in some of these women, when you palpate their neck, you would see their trapezius or the strap muscles to be so solid, so hypertrophied and so stiff. It's as if they are going to the gym and they're working out. some of the patients, some of the women have actually, envied them having this kind of traps. It looks super muscular. I asked them, what do you do? They're like, no, I'm a homemaker. I work, I'm at home only. I don't do anything much. I don't go to the gym or anything. Like, wow. Okay. So this is what is happening. So all the adrenalines and the epinephrines are actually getting deposited in your back of the neck and in your shoulders also. They tend to clench. They tend to grind their teeth. Okay. This can also happen for sleep apnea patients also. Okay. Clenching and grinding. Then what happens? You will end up having TMJ issues naturally. The impact on the grinding is going to go to the joint also. So this is your young fit female
Okay.
people. Headaches, migraines, all the TMJ conditions, TMJ issues that I've said is very similar to the upper airway resistance category of patients. Simple as that. Okay. The third and the most important are the kids. You have seen the movie Tare Zameen Par,
Yes.
right?
Yes.
So what is that first? The facial feature.
His teeth.
His teeth,
buck
right?
teeth, yeah.
Yeah. He's got this superly proclined teeth. Why do you think that's happening? Let's start with that.
Right.
Okay. Now, if you really want to understand a dysfunctional form of breathing in a child, we'll break it down from there.
Okay.
His tongue is constantly pushing his teeth out. He's a mouth breather. He's constantly opening his mouth and breathing. All right. So when you don't have a lip seal, when you're breathing through your mouth continuously, when the lip seal is not there and the tongue is constantly struggling to find its place, it needs more room, it's going to push the teeth out. The teeth are going to flare out. All right. So you're not able to breathe in through the nose. Okay. So that is number one. Mouth breathing, proclination of the teeth, dearrangement of the teeth. You can have a tongue tie, a low resting tongue posture, open mouth breathing when you're sleeping. For kids, bedwetting even after a certain age, even jaw issues, headaches, neck pains. Not necessary that all the kids would have these pain issues also, but you would see all these features. These are a major red flag in kids. So if that happens, it's going to affect their brain development. You would if you see a child snoring, it's a big red flag. Get him to an ENT or a dentist as soon as possible. No compromise. People say, oh, so cute, to see a child snore. Oh, it's not like that. The worst thing that can happen to a child. And if their sleep is disturbed, if they're not able to fall into that deep state of sleep, you're going to get a lot of ADHD problems in kids. Okay. ADHD, the kid is going to be hyperactive. Behavioral issues are going to be there. Lack of focus. Not able to study properly. These are the things. So what do? They put the child on a anxiety medicine.
Okay.
Psychiatric medicine they put the child on. Imagine for a 6 or 7 year old, you're giving the child a medication to bring his brain activity down. Basically, you just have to work on his sleep. I mean, I'm not saying this is the only thing, but this is the most common thing that is overlooked. So I had this opportunity to work with a child from Kottayam Medical College. The psychiatrist there, we had a discussion. She was kind enough to refer this child. So they have this ADHD score. Okay, and it was pretty high for him. This was 8 years back. And then I worked on the child. I just did some very basic breathing and some tongue exercises and certain devices, very, very small, limited use of the device. We did some work. And when I sent him for reevaluation, the psychiatrist there, she was able to give him a different score. And it was very less compared to the initial score. So that was very clear from that. And even in Google, if you go through Google, the literature, it is replete with information. Okay, articles very strongly suggest that ADHD and your sleep, there is a very strong link to it. If you can work on the breathing, if you can work on the child's sleep, then your ADHD levels can also come down.
Okay.
Even the depression, people going through mental health crisis, depression, and all the other mental health issues. Sleep plays a very important role, and your breathing also plays a very important role. The level of carbon dioxide in your body also, the cellular oxygenation also plays a very important role in that. If you can work on these things, it can be a big game changer. No doubt about it.
Awesome, Shankaran. I think this was really enlightening for all the listeners and for me also, because sleep is something I've also started regularizing my sleep. I think I'm a lark, so I have started sleeping early, waking up early,
Okay.
getting myself tired physically. Sometimes I feel I do not get sleep, that initial. But what I've noticed is if I get myself tired, if I sweat a lot by going for calorie or swimming, then that night's sleep is very,
Yes.
yeah.
And also, if you can avoid having coffee or tea after
coffee tea. We are
6
coffee
o'clock.
tea lovers.
Yeah, I mean, I love coffee.
Okay.
I'm a big fan of South Indian
So
filter
till what
coffee.
time should we have coffee?
Any beverage after 6 is not advisable.
Okay. Why is that?
Because the half-life of caffeine is about 5 to 6 hours. So let's say if it has to completely go from your system, it's going to take 10 hours, minimum of 10 hours. Okay, so let's say you have coffee at 6, you do the math. Okay, definitely it's going to have a big impact, because if you want me to get into the science of it, it can be a little boring.
Okay.
Because the caffeine sort of replaces the receptors called the adenosine. Okay, and it takes the place in the receptors, and it impacts or impairs the sleep. Okay, and later on, once that wears off, then it's going to hit you. Okay, the adenosine is going to come back to the receptors, and it's going to attach itself, and it's going to make you even more sleepier. Okay. Coffee is good. I'm not saying it's bad, but if you can, optimize it to your requirement, then that's the best. And me personally, I've seen, I've seen it in myself also, that if you can avoid having food after 6 or 7, then your quality of sleep also goes up really high. I mean, it's going to be a game changer, I tell you. If you can do that, okay.
I'm
nothing
doing that
like it.
actually, yeah.
It's gonna
Before
have- yeah.
sunset, have
Before
food.
sunset, have your
yeah.
food. It may sound a little too radical for some,
Yeah.
but try it and see it. I have done it on myself. I have seen the difference. If you can do that.
For me, it's like total difference because I suffer from anxiety a lot. But when I just corrected my sleep, I was doing all the kriyas, it was helping me.
Right.
But like you said, just correcting sleep, working on the basics like food, exercise, and sleep, it just skyrockets the entire
Yeah.
process.
And see, even there is a lot of misunderstanding. People think that just because they do a kriya, their breathing is going to be good. No, it's not like that. This is where it's important that if you can measure, your carbon dioxide level, capnometer if you can get it, and if you can measure it, it tells you the level of carbon dioxide in your body. Okay, and if you can optimize that, then that's going to be a big difference. It's not necessary that every time you do a kriya, it's going to be all right.
Yeah,
Okay,
true.
that is there. So that is that.
So that's the end of our podcast.
Wow,
Thank you for
okay.
coming and enlightening us about the topic again in English. Because last time when I put out the reels of it, one of the volunteers said if this was in English, that would be really helpful.
Oh, really?
And I also
Okay.
felt, if it reaches the right people, because a lot of meditators are struggling with backache, neck pain, and I think, they might be able to reach out to you and
Yeah,
do
I mean,
whatever is needed.
I'm all game for it. I'm happy to help. If I can even refer them to somebody who is closest to them in whichever city that they are in. If there is a provider there, that's the best. I can do that also. Yeah, I mean, it's such a fascinating subject. It's such a huge subject. I don't know if we have actually done justice to the to the topic, because it's such a huge topic. But I think we have covered quite a bit, and I think our audience would have understood this, at least from a superficial level, at least the basics of it they would have been able to grasp, is what I feel. I think you asked fantastic questions. Thank you.
Thank you. Thank
Right.
you. And hopefully we'll see again.
Again,
For Hindi podcast.
Hindi
You should
podcast.
learn Hindi soon.
okay, at your own risk. Huh?
Okay, any last words before we end?
Oh, no last words here. I mean, what can I
Yeah,
say?
correct your bite. That's
Correct
the
your bite. If you have any of these issues, try optimizing your sleep. Sleep and airway, they go hand in hand. That's it. Just understand this.
So thank you, Shankarana, and hopefully if you like this video, please do like it, share it. But share it if I'm sure you have someone in your family who's going through a migraine or neck pain issue. Please do not share it with random people. Share it specifically with such a person, because it might help them a lot. So hopefully, thank you, and namaskaram.
Namaskaram. Thank you so much. Bye bye.